Thank you, Mr. Speaker Pro Tem. Ladies and gentlemen of the House, I rise this evening to speak to an issue of great importance to me and to the people of the state of Maine. I also rise to speak in favor of the pending motion to accept the majority ought to pass report, and by doing so, accept a comprehensive measure that would make a final payment on Maine's hospital debt and reduce future hospital costs by accepting federal health care dollars to cover tens of thousands of Mainers. Today, lawmakers have an opportunity to pay back the debt that is owed to our hospitals and contain the rising cost of health care for our people and our hospitals. We have an opportunity together to do three things in one bill: help our hospitals, help working Mainers who need health care, and help our economy. For 4 years, I served on the Health and Human Services Committee, where we would consistently hear about the amount of charity care and bad debt the hospitals absorbed and then shifted onto working families with insurance and onto Maine businesses. When people without insurance get sick, they often end up getting care in the emergency room, where it is the most costly, least efficient way of providing care. Just last year, the Maine Hospital Association reported that Maine hospitals provided $450 million in charity care and bad debt. The hospitals cannot afford this, and neither can we. In the proposal before us today, not only do we pay back our hospitals, but we also ensure that thousands of Mainers can see a doctor when they are sick. By doing so, we reduce the charity care costs and bad debt that are cost drivers for our hospitals. This is a win for our hospitals and every Maine family who has insurance today. Now, for several months, we've talked about the nearly 70,000 Mainers, many of them who are working but cannot afford health insurance, who would be eligible for coverage under this legislation. The number is so large and has been repeated so often, it's easy to forget what it actually means. We could cut the number of people in Maine without health insurance in half. 70,000 people. That's equivalent to the population of Aroostook County or Somerset and Piscataquis County together. Just think about that. That's a lot of people. The county by county numbers are compelling. Residents and hospitals in Maine's most rural counties have the most to gain. And I will not outline every county, but I will give you a sample of what this would mean to some of our counties. In Aroostook, 4,615 people would gain health insurance, and it would inject $16.8 million into the county's economy. In Androscoggin County, 5,829 people would gain health care. $20 million would be injected into their health care economy. In Penobscot County, 8,444 people would gain health care, and $31.6 million of economic activity would be injected into Penobscot County. Now, after thinking of those numbers and those 70,000 Mainers, I want you to think of an individual example, maybe a family member, a friend, a neighbor, somebody that you know, maybe yourself, who's gone without health insurance. Now I'll take Marie from Bangor. She has a part-time job that doesn't provide health insurance. She also has a serious heart condition that doesn't allow her to work full-time. Without health insurance, for her and her family, she is forced to choose between putting gas in her car and paying her medical bills and utility bills. This is not a hypothetical scenario. These are the hard facts for too many Mainers. And this is an ethical and moral dilemma for all of us. Unfortunately, Maria is one of tens of thousands of Mainers, many of your constituents, who are unable to afford health insurance. The personal stakes are high for thousands of people who could receive life-saving access to health care. But there is also a tremendous opportunity for our entire state. The Maine healthcare economy is the largest single job provider in the state of Maine. Healthcare jobs account for 1 in 5 jobs in Maine. By accepting these federal healthcare dollars, we will inject a total of just over $250 million into our healthcare economy, and in doing so, we will create more than 3,000 jobs. In addition, it's estimated that Maine hospitals would receive an additional $163 million each year in additional revenue if we were to accept these federal dollars. This will help alleviate the current burden hospitals are facing and make sure we prevent future debt from accumulating so that we avoid a situation like this in the future. Maine's hospital debt is a symptom of our high healthcare costs. This comprehensive measure pays the debt and helps fix the underlying problem that contributes to high healthcare costs in the first place. We don't just treat the symptom, we treat the problem. The federal government has agreed to fully cover the cost of health care for tens of thousands of Mainers for the next 3 years and gradually lowers its payment to no less than 90% of the cost over a decade. There is no cost to the state. In fact, we will save money. Maine is projected to save $690 million over the course of 10 years if we accept these federal dollars. And this is according to the nonpartisan Kaiser Foundation and repeated by the conservative Heritage Foundation. We are actually one of 10 states that will see our Medicaid expenditures go down over the next 10 years, not go up. If we want to save money in our Medicaid account, which I believe we all do, we must accept these federal health care dollars. This could change the lives of tens of thousands of Maine people who fear getting sick because they can't afford to see a doctor when they need it most. Accepting these federal funds to increase health care coverage for more working Mainers is morally and economically the right thing to do. And it makes sense to do it as part of a comprehensive package that repays Maine's hospital debt. It both addresses the costs of health care for our hospitals and our people. To do one without the other would leave the job half done. It's a good deal, and it's one we must not walk away from. And that's exactly why Republican governors across the country have sized up the proposal and have decided to accept the funds. Take, for example, Republican Governor Jan Brewer of Arizona. She has said turning away federal Medicaid dollars would increase human suffering and further cripple hospitals and other health care providers that care for the uninsured. Governor Brewer recently said, and I quote, "Being governor is tough. You have to make tough decisions, and you have to look at the whole state. You have to do what's right. Without expansion, we would have had to go in and get people off of Medicaid. They would still be in our hospitals. You would still be paying for them." Governor Brewer's bill to accept these federal dollars is actually called the Arizona Health Care Cost Containment Measure. Governor Brewer gets it. In New Jersey, Republican Governor Chris Christie has made a similar case. He said in a speech before the legislature, unveiling his budget, quote, "It's simple. We are putting people first. Expanding Medicaid is the smart thing to do for our fiscal and public health, and will ensure New Jersey taxpayers will see their dollars maximized." Governor Christie also gets it. This should not be a political issue. We all agree we should pay the hospitals. But what we are at an impasse over is health care for tens of thousands of Maine people. The members of this body have a choice to make. Will you support a plan that pays the hospitals and accepts federal health care dollars to cover more Mainers? Or will you choose to deny and delay health care for tens of thousands of Maine people, putting politics ahead of the people's health and our hospitals? I urge you to see this for what it is, a compromise that will benefit the state as a whole. This is how state government should function. In a divided government, neither party can get anything done by demanding all or nothing. I urge you to join me in supporting the pending motion. Now is the time to act. Thank you, Speaker Pro Tem, and thank you, ladies and gentlemen of the House.